Hi, this is Dr. Daniel Jacobazzi from Fix Me Physical Therapy, and today I'm going to talk about what I call the 7 deadly sins of painful peripheral neuropathy. And most people don't even know they're doing them, and in this case, what you don't know can hurt you. And I'm going to look at my little crib sheet here. And of course, right at the top is neglecting lifestyle and diet. For the type 2 diabetics especially, that's the thing that kind of ended you up in the situation. So avoiding those processed foods, avoiding sugary treats, doing everything you can to keep that blood sugar low and level without having to resort to insulin is certainly something that should be at the top of your list. Another thing that most people don't know is that there are actually several supplements that can help people with diabetes modulate their blood sugar and in support along with insulin. I'm not saying stop medications, absolutely not, but can help. And so 2 of those off the bat would be berberine and chromium picolinate. Both of those, when taken right before or with meals, will help lower that blood sugar naturally without having to resort to insulin. And of course, this probably goes along with diet a little bit, but number 3 would be alcohol consumption. So alcohol, when it gets into your liver, is broken down into sugar, which is going to do what? Going to spike your blood sugar again. That's going to cause problems. So we definitely don't want to drink alcohol. And there's another issue with alcohol. Alcohol is a neurotoxin, so it actually damages your nerves further. So if you have painful peripheral neuropathy and type 2 diabetes and you're drinking, that's a bad combination. Medications, so reliance on medications alone, thinking that medications are going to save you. There are no medications anywhere that are designed to cure neuropathy. None. Zero. They may make you feel better, but they're not going to do anything in terms of helping that neuropathy heal. And again, that goes to the next seventh of the 7 deadly sins, and that would be confusing management with treatment. Anything that's offered in the medical system, and medicine's great for many reasons. Of course, that insulin keeps us alive. There's all kinds of other things that medicine does very, very well. But again, back to medicine, if you ask an MD about your neuropathy, they're going to say it's incurable. If you look online, they're going to say it's incurable. So all of them, and we wrote another post about this as well, look at that situation as something that just you have to live with and deal with. And that's not the case. The system that we've been using has been operating since 2008, 2009. And for patients that can be accepted into the program and are compliant, it's got a 97% success rate, which is just out of this world. And of course, the next one is not seeking support and education. So many people stop when their doctor says what's incurable. And so they just expect, oh, there's nothing I can do. I just have to live with it. That's pretty close to giving up. And neuropathy is not something that you want to let go, because neuropathy is progressive and degenerative, which means it is only going to get worse unless you do something to help yourself. And so this is the thing where you're going to have to step up and help yourself. And of course, last on the list is ignoring the importance of physical activity. And so physical activity can be uncomfortable, even painful, but getting moving is going to keep that blood flow. And of course, at the base of all peripheral neuropathies is the lack of blood flow, which is leading to this problem. So whether it's tied to the type 2 diabetes or varicose veins or some other issue, again, there's over 100, almost 200, I think 200, at least 200 different types of neuropathy. It doesn't have to be diabetes. All of them come back to decreased blood flow. And the program that we use helps restore that blood flow. And again, if you can be accepted into the program and are compliant, the success rate is out of this world. So if you have any questions, please give us a call at 773-852-3335 or send us an email at help@fixmept.com, which I'll put down below in the comments. And of course, smash the like button if you learned something today. Thanks, and we look forward to hearing from you. We'd be happy to help in any way we can.